at the point which finishing Dr. Mustafa that we will stay in our Palestine. Let me to start my talk that my father and I am now in Gaza in Deir al-Balah, but my father and mother was born in Ashkelon, which is far from the Gaza city, 15 kilometers, and located in the occupied territory. After, let me to talk about the situation and healthcare system in Gaza now. After 1,000 days of genocide, the situation is unfortunately still very bad and worse. In spite of the ceasefire is happening, unfortunately, ceasefire, it is only superficial, and the targeting of the people and targeting of the civilian is continuous. Daily we are receiving more than 15 dead bodies and killed, and more than 15 are injured. The situation regarding of the continuous of targeting, siege, and rejection to enter anything inside of Gaza. Unfortunately, Israel, they are transfer of Gaza city to be as the biggest prison for civilian population in the world. The biggest prison that you couldn't enter or exit from this Gaza only with permission. So that regarding of that, the limited number of the patient which need to transfer out Gaza due to unavailability of the service is huge. We are talking more than 20,000 of patients. They are asking for the service which is not available in Gaza. Increasing of the siege, increasing of destruction, and availability of the service, lost more of our services, including of our facilities. We lost more than 70% of our bed capacity inside of our hospitals. And you can imagine how we can provide and ensure of the service for our population, so that the number for the population which they are needed for transfer is huge. Unfortunately, the story not stopped here. All of the health determinants is destructed, including of the water, the food, displacement, household in the tents. 70% of population is still in the tents. Between the rates, between the insects, the increasing distribution of the infectious diseases, this is increased the burden of the diseases on our healthcare, which is most of our health facility is destructed. The situation, unfortunately, after ceasefire, it's still worsening due to none allowed to enter of the basic things for the health, like drugs, disposable, generator for electricity. You know that Gaza, until now, we haven't station of electricity. Our hospital dependent of generators. You can imagine in which city in any world that generators, which is dependent the hospital for this electric generator, they didn't find oil for this generator because the occupation didn't allow this oil lubricant oil for generators to enter in Gaza. You can imagine the situation regarding of the basic equipment, medical equipment. Until now, Israel didn't allow enter any of this equipment. We lost more than 17 CT machine, and now we are only providing of this service for 3x3 machine. Until now, most of X-rays machine, unfortunately, Israel, they didn't allow to enter any X-ray machine. You can imagine the situation regarding of this situation, and in this condition and continuous of Israel that didn't allow to enter anything to rehab or to expand or to restart any services. Only most of our service inside of Gaza, unfortunately, we are providing in the non-permanent structure and by field structure, and some of rehabilitated structure inside of it. Still, unfortunately, Now, our capacity in the healthcare less than 60% in the level primary healthcare and in the level bed capacity. What's meaning that? We have a big challenge to continue providing safe practice and safe health for our population. Why? Because all of the world are witnessed the criminal regarding of the population, civilian population inside of Gaza from the occupation side. So that I think that continuous after 1,000 of genocide, of 1,000 days of genocide, continue this suffering, I think that this is inhumanity and unaccepted in this world. And thank you very much from Gaza and from our population here.
Thank you very, very much, Dr. Shatat, for this very important